Knee that locks, gives way, or doesn't bend due to meniscus problems. In this video, I'm going to show you the best exercises for you to do at home to improve the positioning and movement of your menisci. And this can relieve the pain and unlock your knee like magic. Cool. Pretty crazy. And these exercises are safe because they don't put stress on your knee or involve weight-bearing movements. That's the big danger for anyone who has a meniscus problem. Tear, degeneration, injury. That's why your knee gives out. That's why your knee locks up almost every time you're walking or standing, because the knee is supporting the weight of the body. The first exercise will help with the positioning, both of the lateral meniscus, which is on the outside of the knee, and the medial meniscus, which is on the inside of the knee. The secret is to press in the right spot and move the right way. It sounded like an Itaú commercial. Let's do it step by step. Start by placing your foot on a chair. If you can't bend your knee that much and find it difficult, you can do the exercise sitting on the chair with your foot on the floor. Here, it's just easier for you to see and understand the exercise. The first step is to find the right spot to press on, and that's super simple. Check it out. Right in front of your knee, if you put your hand there and try to feel it, you'll notice there's a band. It's about 1.5 fingers wide, a hard band, which is the patella tendon. You're going to place your index finger, the pad of your index finger, right in the middle of your knee, right on the sides, both the inside and outside of this tendon, this hard band. It's like I'm covering the eye of the knee, and I'm going to ask, guess who it is? It's to apply pressure. Sorry, gentle pressure. Okay? If your hand gets tired, you can use your middle finger. The middle finger. Look, to reinforce this support here. Okay? This way, your hand gets less tired. And here, the right movement is simply to lift the front of your foot and turn your foot outward and inward, keeping your thigh still. You will feel your knee moving right under your finger. That shows you're in the right spot, okay? You will use this finger support to help with the knee movement. What do you mean, Dr. Alexandre Mota? It's easy. If the foot is facing inward, I use the inside hand to help the knee rotate. If the foot is facing outward, I use the outside hand to help the knee rotate, okay? It's always about helping the movement. Keep going, look. Outward, inward, using support to help it along. No rush. Do 10 to 20 movements. If you get tired, you can stop, rest, and then continue. Improving how the menisci sit will already make your knee feel lighter, looser, but it's also preparation for the next exercise. That's true. After improving how the menisci sit, it's time to improve how the menisci move. This exercise is what will prolong that feeling of a lighter, more aligned knee and will reduce episodes of locking and giving way in the knee. When you walk, run, climb stairs, or do physical activity, we'll need to use the position of your foot for this exercise, because in case you didn't know, the knee depends on the alignment of the hip, the ankle, and the entire leg. In fact, if you want to go deeper and take an extra step to take care of your knee, I have a 2-week exercise program for you to do at home. Each day, there are 3 different exercises for you to stabilize your knee, align your entire leg, and start strengthening. The link to the Te Tiago No Joelho program is down below in the description for anyone who wants more information or wants to start the program right now. But as I was saying, we're going to use the position of the foot to help the knee. This time, you won't need to use your hand for support here. You can relax and rest your hands. And you're going to do a small test. First, turn your foot outward and try to bring your knee forward. See how easy this movement is. Then turn your foot inward and bring your knee forward. I want you to identify which movement is easier and which one is harder. If it's easier with your foot turned inward or with your foot turned outward, we will always start with the movement, the position that makes the movement easier for the knee. For me, moving with the foot turned inward was easiest. So I'll start with the foot turned inward, foot turned inward. If it was easier for you with your foot turned outward, start that way. Understood? Let's go. Here, I can use my hand to help with the move. So if the knee, the easiest for me is the knee facing inward. I take my hand and help the knee turn inward. And here, I make this movement of going forward and backward slowly as far as is comfortable. Let me turn a little to the side so you can see better. Look, in the easier position, use your hand to help as you move back and forth as far as is comfortable 10 times. Then do the harder variation, the position that makes the movement harder. Use your hand to help and move back and forth. Again, as far as is comfortable. Be careful not to force it. 10 times. If your knee has been swollen before, if you've already had a joint effusion, alone. A complete step-by-step to help. It works in these cases. In this video here, just click here on the screen to watch. And if I managed to help you today, send it for comparison. Share this video with someone who has knee pain, who has some knee problem. That's all I ask. Let's promote prevention and keep this chain of kindness going. Well, I'll stop here. Big hug and see you in the next one.